As we age, with our changing physiologic conditions, we see more challenges with cardiac health, cancer diagnoses, mental health struggles. And so with all of these growing list of chronic comorbid conditions, it is important for the patient and the provider to have a good grasp on all of their multi-complexities, the multimorbidities. It's important to have good communication between specialists and also good communication with the families. It's important for the patient to understand the expected prognosis of their chronic conditions if they're able to do so, or at least their healthcare provider, their healthcare proxy would have this conversation with the medical provider. In speaking about maintaining a healthy aging lifestyle without medications, it would be important for an older individual to focus on their physical and emotional health. Going outside for 30 minutes of exercise every day or 150 a week would be highly recommended. Maintaining a good social support and social interaction, given that oftentimes we are very we're a social community. This would also help with the cognitive exercise, cognitive stimulation. It's important for good nutrition, balanced diets, very similar to the instructions for a younger population, but for an older group of individuals, it's good to recognize that as our bodies age, we do have less reserve, and so maintaining these is much more important. Going for a walk every day to maintain your walking and your balance is much more important for an 85-year-old to reduce his or her fall risk versus a 27-year-old. As with any individual of any age, I do recommend getting the age-appropriate vaccine. For the elderly, the older population, it is important to maintain, for example, flu vaccine, pneumococcal vaccine, especially around the seasons where these diseases are more prevalent. It's important to protect oneself when, as you age, your immunologic reserve, your physiologic reserve is decreased, and so maintaining your best health with the appropriate vaccines is very important. It's often a difficult conversation for those who maybe their whole life have not been taking the vaccination, but in our older population there are greater complications when one is affected by the influenza virus, greater hospitalizations, greater mortality. So it is very important to stress that this is something in the older population. You are more vulnerable, and so it is important for you to have this vaccine. Geriatricians are very strong components of getting the vaccines that are appropriate for that time. So we always push for the flu vaccine. We want the pneumococcal vaccine. The varicella-zoster virus isn't always covered. However, it is something that can reduce the complications after having the shingles. There are all of the vaccines, as a primary care physician, we always promote as something that will help reduce complications thereafter. It's always challenging if you have a patient who really just says they don't like needles, they never get vaccinated. Sometimes it's worth it to explore deeper reasons why. Maybe they knew somebody who got the flu vaccine and then consequently got the flu, and maybe explore that so that you can counteract with perhaps the reasons why you can debunk what their myth may be. Other times you may be able to pull in having that person get the vaccine so they can maintain their health in order to spend more time with family, grandchildren, people who may also be vulnerable to getting this illness if everybody were to get sick. So there's multiple reasons. It's never an easy question. Go for the motivational interviewing and see if you can find some root there.